let's get started. So I was very excited to read your blog, and the reason I was excited to read your blog is I did a talk for Parker on chronic pain, and the more I put together the blog, the more I realized that chronic pain was just kind of a sequelae of all the or acute stuff that we see in practice all the time. So when I read your blog, I had a couple questions that I wanted to ask you, and really not even, get your opinion as an expert like you are, but more to get your opinion as a provider, because that's where I think that the gap lies, is not necessarily in the knowledge that we have as chiros. It's in how do we get this knowledge to our patients. And I think that's one of the hardest things. So you brought up in the first couple of paragraphs of your blog that it's not an anatomical source of pain when it comes to chronic pain, that you have this peripheral source. However, you have those psychological overlays, you have those workspace overlays, the socioeconomic overlays. So I guess my first question to you, Dr. Williams, is how do you identify that? From a typical evaluation and management standpoint, how do you get to the bottom of those overlays in the limited time that we have as chiros?
Well, as you know, going through the diplomat, the orthopedics diplomat, or now it's called neuromusculoskeletal medicine. Um, you know, in that learning, they make it very clear that after about 3 months or so, and most experts and most guidelines associations agree that after say 3 months or so, pain starts to begin to transition into the chronic phase. The acute, subacute, easier to treat, hadn't been going on very long, that phase into now we've got some long lasting pain, and now it's going to be a little more difficult to treat. And so one of the main teachers there is Dr. Anthony Nicholson. He's just a brilliant, amazing human being, as you know, Dr. Nicholson. And I asked him because it was confusing to me at first. So I asked him, I said, so you're telling me that pain after 3 months, roughly, everybody's different, but so pain after 3 months in a person is basically chronic pain. And now we have to start also looking at it as more and more of a centralized pain. And he said, yeah, he said, when you boil it down like that, it sounds extreme, but yeah, in the national pain strategy, I believe Dr. Lehman said that was described as pain that was experienced at least every other day for 6 months or more. So, some experts, some guidelines are putting it at 3 months. National pain strategy every other day for 6 months. So for my patients, I just look anywhere between 3 to 6 months. It makes sense to me that they're starting to make the transition in that time period to chronic pain. And so now it can't just be treated peripherally, usually.
So really the timeline is the biggest variable in there. Obviously you're gonna tease some stuff out in the history and the exam. What about flags, like yellow flags form, a promise score? Do you use any kind of standardized method just to document this for the patient and possibly whoever's paying the bill?
That is, we always do OATs, we always do outcome assessments, but when it comes down to, and everybody needs to be doing red flags to decide whether we need to do imaging or anything like that. So yeah, we do that, but as far as official yellow flags, no, I'm not smart enough to do that. I mean, I am, but we just haven't yet. But you have those inside. When you hear people start talking about fear avoidance, or they're I'm only 38 and I'm already worried about what I'm going to be when I'm 60. How am I going to function? Or I'm already not keeping up with my, you hear those things. Those are your yellow flags. And as soon as I start hearing those, that's when I start really kind of diving in a little bit deeper than, oh, you've got facet pain, so let's do this.